The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm excited to have our returning guest. I think this is the third, maybe the fourth appearance on the show. So forgive me. I'm being shown that it's the seventh. So I think this is the record for visits on the show. There's a reason why we invite you back so often. Charismatic and has so much information and wisdom to share. Brandi Hooker Evans, say hello to everyone.
What's up, guys? I am so glad to join you again, Patrick. This is my favorite show. Obviously, we keep doing it, so.
Well, thanks for saying so. I know your shows always do really well as far as downloads are concerned. So grateful to have you here. Let's real quickly, because I know we've done this 6 times before. Let's just quick background. You're a dental hygienist, but you're a coach. Kind of tell us your background, what you do now.
Yeah, so my favorite project that I'm really excited to share with y'all is this year, my book, Dentists, Hygienists, and Cows, came out, and I'm so proud of it. I put a lot of love into it, as you can imagine, and it, hit the top of the charts on all the Amazon parameters, so I hope that the work in that book is an excellent guide that anyone could pick up and read and apply at their office tomorrow and be able to have the nuts and bolts of how to have an incredible day while providing amazing individualized care to each and every patient that they have the honor of serving.
I'm guessing part of that clever title the cows part of that title came because you're in Idaho, right? Idaho or Iowa? It's Idaho.
Yes, sir.
Yep.
Yes. I am
Idaho.
in Idaho. And what's great about the cow title is there's several pictures in the cover of the book. I'm actually in the field with the cows behind the fence, truly feeding them with my hand and standing in the middle of these, gigantic, more than 1,000-pound animals. And they are so much like dogs, and it's just another testament that if we treat people or animals individually with love and care, you can actually see a lot more out of them than you would if they were just regular stock animals.
I know a big part of what drives you in healthcare, what drives you as a hygienist and as a coach is caring for people, right? And that can mean obviously healthcare. It can also mean emotional, right? Support, these types of things that we can lean on to really help us be a more amazing people. So let's kind of jump into today's topic a little bit. So you started, you told me about something that you read, an anonymous post today. Why don't you go ahead and share that post? Let's start there.
Yeah. So gladly. This is a private email from another dental hygienist. She says, well, she did post it though, so you're not off. She says, I just posted this anonymously in the dental hygiene group. I cannot believe that we are still debating this. The dentist and I are at odds about alternating 1110 pro fee and 4910 perio maintenance. We are a fee for service practice, and her feeling is, why would we stop alternating the codes if it is helping the patient get their visit paid for each time? Her feeling is she doesn't really care what the code is as long as we are maintaining the periodontium. She really doesn't care how it gets billed out, especially since we don't participate with any plans. I explained that this code is attached to a diagnosis and they should not be alternated. Is insurance fraud still a concern when we are a fee for service? Please give me articles and podcasts to help me understand and help us both get on the same page. And I actually get this question almost every time I speak, and definitely every time I coach. And there's a bottom line crux to the issue here, Patrick. And what it boils down to is, are we being honest with ourselves, with our patients, and with the way that we bill? And you do not have to be a clinician to know that honesty is a great virtue to live by. Fair?
Sure, absolutely.
So what we see happening in this situation is it is a clinician that is waffling between preventing the disease and saying that they're maintaining the disease. So if we're going back and forth, if those medical records, those dental records were ever to come into question, it's fraudulent. Whether we're dealing with the insurance company or not, it's not true. If the person is not having prophylaxis services done, it's a lie. And that's a problem. And I really believe that it's so hard to play the insurance game. And I get that we really want to help our patients utilize their benefit. And if they are not a fee-for-service, or if they're a fee-for-service practice and they're not directly billing the insurance, there's a false sense of security that because we're not billing the insurance, we don't have to worry about fraud. That's not necessarily the whole story, right?
Right. Yeah. And let me kind of jump in here a little bit so that I can understand a little bit better. So I can understand, I'm not saying that it's right. I can understand how someone who may be getting a better reimbursement may want to code a certain way. That might be for those who don't know better. It might be a gray area. And again, I'm saying for those that don't know better, for those who do know better, it sounds like it would be fraudulent, right? And I know that's a very slippery slope. But why would you ever want to do that as a fee for service? What's the argument from the dentist here? I don't understand. Even if they were motivated by money, greed, fraud, whatever, bad business practices, why would they want to do this in a fee for service practice?
So what the patient is able to do is take their dental bill and submit it to their insurance company separately. So they usually don't pay at the full rate, but they will often still reimburse the patient or even the dental office directly, depending on the way the billing goes. So sometimes people misunderstand that fee for service means they don't accept insurance.
Right.
And that's not exactly correct. So that by itself is a little muddy. And I agree with you. I see that we're trying to get the insurance to help as much as they can.
Right.
But in that journey, we are seeing all across the board that it's almost as if the insurance machine is growing and then the providers are having a harder and harder time expressing what the patient needs and getting the patient to have the benefit come from that machine. And so my invitation is be very clear and honest. Make sure that you understand what the code is, what care you provided for the patient, make those match. And then we have to go to battle. We have to say our patients need this care. And if we don't, if we lie down and take it, not only are we the victims of this unjust system, but then our children and our grandchildren that are going to be taking over our practices, and maybe not my bloodline personally, but you get the idea. The legacy that we're passing on is unhealthy.
So, but here's what I'm struggling with. One, the dentist is actually just kind of taking the path of least resistance with the patient and actually telling the patient their services aren't worth as much as what they're charging, right? So they're actually telling the patient that somehow, some way, especially when the insurance company comes back and goes, what's going on here? So that's happening. The other thing that's happening too, and I think this is just as equally concerning. And again, I'm not judging anybody because knowledge is key, right? So what people know is really important, and how they fit into the process is really important. But we're talking about a dental practice. We're not talking about like the US military here, right? So following commands, if you know that they're wrong, there's some fault there too, right? So if you're working in a practice and you're being told that you need to miscode, aka commit fraud, if it's not gray, if it's very black and white, there's a problem there too, right? Nobody's on a moral ground here in this situation, are they?
No, there's no. If this comes back, there's no footing for that provider to stand on. None.
Okay.
And the reason why we know this is because the way that the hygiene codes work is you can either prevent, treat, or maintain disease. Right. So if you were to prevent the disease, but you wanted to have them on a more frequent recare, without doing treatment, the scaling and root planing codes, then you would just have them back for quarterly prophies, that 1110 code.
Right.
But once you've done scaling and root planing, you've acknowledged that there's permanent damage present. There was bleeding and bone loss, so active disease. So we build scaling and root planing. That's when you move to that 4910, which is a periodontal maintenance code. And the goal with that is to prevent us from going back to active disease. We want to maintain the best health possible and help the patient move towards their healthiest version possible, knowing that we have already lost permanent structure.
Right. So let me give some advice to the dentist out here, and you can tell me that I'm wrong or way out of line. Maybe not wrong, but out of line. I think you need to investigate always why you're trying to justify your fees, right? And there could be a lot of reasons for that. I think most of it's going to be fear-based. There's a lot of other reasons why people don't think that they're necessarily good enough, and that's something that you should investigate. Maybe get some help with, and I mean that sincerely. Like find some coaching, dive deep into some books. That's a real thing. For the hygienist, Brandi, what advice do you give them when you have this? And this is how to handle this one situation, but this can be applied to all. There's always going to be a butting of heads, right? We've seen it play out. We see it play out publicly. It's a thing. How do you handle this as a hygienist, someone who's not the doctor, right? Who doesn't have that credential, who's not usually not the owner, right? So not the 4-letter word, the boss. How do you handle this? What's a good way to, one thing I did love is the person asked you, hey, what are some blogs? Some things that I can read that can help us get on the same page. So having the attitude of getting on the same page is great. That's a pretty graceful way to handle that, I think. What do you say?
Well, my hat is off to this particular hygienist. That's the first place to start is where are we going wrong philosophy wise? And like I said, whether you're a clinician or not, it doesn't matter. We're talking about veracity here. We're talking about living as a truth-telling human being. So my guess is that if the hygienist is working for the dentist and in that relationship, she has a modicum of respect and appreciation for her as a human being. So her saying, what can we do to get on the same page is perfect. I would invite the hygienist or the dentist, whoever's off with the other philosophy, do a little bit of research and then come to them outside of work and say, hey, would lunch on Tuesday be a good time to meet and discuss what we're hoping for patient care? And then
Sure.
I would bring it back to what is it that we as a team want to provide for our patients and what code of ethics do we live by while we're providing that care?
Right.
And once you can get down to the bottom basement of like, what does this truly mean? Like we can argue the codes and we can argue insurance all day long, but it's pretty hard to argue with core values. If we can start from there and then build up, a lot of these details, Patrick, you've seen it happen time and time again. They shake themselves out pretty well, and you can use them as examples, but they're weeds, and we don't want to get caught in the weeds. We want to get back to, we live in a veracity place from our, or a voracious, not veracity, a voracious place, and we are going to provide care that is truthful, and we're going to bill what we believe that it is worth and stick with that because it is worth what we bill.
Yep. Makes tons of sense to me. So what I want to do is a couple of things here real quick. Next time that you're on the program, which I hope is sooner rather than later, I want to talk about this. So I'll challenge you and kind of rope our audience into coming back to hear the next one, is how you can pay your hygiene team members, your hygienists, more money than what you're paying them right now and make more profits than you've ever been made before in hygiene. So that's a pretty tall order. So I know a lot of people complain about the wages that hygienists are now demanding in the marketplace. I get it, but we can cry about it. We can complain about it all the way, or we can find solutions to increase the gross revenues, cut costs somewhere else to make more money there. So let's talk about that next time you come on. Next thing I want to do is real quickly remind our audience website, brandihookerevans.com. Ton of information on there, some awesome downloads, great book, place to find it. Brandi, thank you for being here. Appreciate you so much.
Thanks for having me, Patrick, and good luck to all of you out there. I am sending you so much love and just the courage to operate from your core values, no matter the situation you're in.